Respected teachers, seniors, and batchmates, I am going to present the slide number 1. History. 25-year-old male presented with painless swelling in parotid area. In this slide, we can see that the wall shows lymphoid proliferation with germinal center formation. In the second slide, we can see that the cut surface shows the cyst wall and the cavity is filled with cheesy white material. The features are suggestive of lymphoepithelial cyst. Now, the review of literature. Lymphoepithelial cyst. Lymphoepithelial cysts are lesions of the parotid or upper cervical lymph nodes characterized by unilocular or multilocular cystic formations which are lined by squamous epithelium surrounded by a florid lymphoid hyperplasia with prominent germinal centers. They are also known as branchial cyst. Age. Most commonly, it is seen in young adults between 20 to 40 years of age. Sites. The common sites of head and neck are the salivary glands, commonly the parotid, and most commonly the anterior triangle of neck. The other sites are the other areas of neck, oral cavity, salivary glands, thyroid, mediastinum, and even in pancreas. Now, the gross features. The swellings are usually non-tender, diffuse, fluctuant, and painless, and are well circumscribed and about 2 to 5 cm in diameter. The figure shows lymphoepithelial cyst. Microscopy. The cysts are lined by stratified squamous or pseudostratified columnar epithelium. The fibrous cyst walls contain lymphoid tissue with prominent germinal centers. The amount of the lymphoid component is variable, and the cystic lining is often infiltrated by lymphocytes. The cyst contents may be clear or watery or mucinous and may also contain desquamated cells and granular cellular debris. This is likely an acquired process resulting from the proliferation of branchial pouch derived or analogous epithelium induced by the lymphoid hyperplasia, probably through a specific interaction between the epithelial cells and a subset of lymphocytes. Now, we shall talk about the lymphoepithelial cyst and its association with HIV. HIV associated salivary gland disease is a lymphoid hyperplasia in the parotid and sometimes the mandibular gland with lymphoepithelial cyst and lymphoepithelial lesions in the HIV patients. Their incidence is 3 to 10% among HIV positive patients. It is CD38 positive. Now the investigations. Number 1. Fine needle aspiration cytology is done. It shows the presence of lymphocytes, squamous cells in the proteinaceous background. Number 2. Computed tomography, that is CT scan, is done to assess the site and size and extent of the swelling. Number 3. Histopathological examination is also done to confirm the diagnosis. Now the treatment. Conservative, by decompression of the cyst by aspirating the fluid out of the cyst. Number 2. The definitive treatment is the surgical excision of the cyst. Now the differential diagnosis. Number 1. Branchial cleft cyst. Histologically, it is similar to lymphoepithelial cyst, but branchial cysts have a accompanying sinus tract or stalk, and lymphoepithelial cyst is intraparotid. Number 2. Parotid duct cyst. Dense lymphoid infiltration of the cyst wall distinguishes it from the parotid duct cyst. Number 3. Wharton's tumor. It's multilocular, prominently papillary, and it is dominated by the oncocytic columnar cells, and hence it becomes a differential diagnosis. Here are the references. Thank you.